Welcome to the CMSC's virtual poster tour. This poster is titled Strategies to Foster Buy-in for Physical and Occupational Therapists, Engagements Across Multiple Sites and States for a Study on Tele-Exercise and Multiple Sclerosis, or TEAMS. I'd like to introduce the presenter, Tracy Flemming Tracy. She is an occupational therapist and clinical research coordinator at the Tanner Foundation for Neurological Diseases in Birmingham, Alabama. Welcome, Tracy.
Thank you.
Telehealth programs are much more relevant now during the COVID isolation. So tell me some of your thoughts on that.
So when we first started this project, or when they asked me to be a part of the research team, being an occupational therapist and being someone who has only really done hands-on in a clinic, I was a little nervous, definitely about offering this unsupervised remote rehabilitation program, but also interested because I had heard from a lot of my patients, and I had seen evidence of this in the clinic, that it's not always easy to get to physical therapy and occupational therapy appointments. And we also have people that come from all around the state to see us at our specialty center, because it's difficult to find a therapist in their area. So I thought there might be some benefit. But now, of course, with this new unprecedented time that we're in, it is even more imperative that we have this sort of option, particularly for people with MS who are at the high-risk population already. So,
your poster title starts with the words strategies to foster buy-in. What do you mean by that, and why do you need to foster buy-in among physical and occupational therapists?
Yeah, so we are actually offering this program in 43 clinics across 3 states. So it's Alabama, Tennessee, and Mississippi. And we are often in rural parts of the state where there might be only 1 or 2 occupational or physical therapists practicing in that area. And typically these people might be more focused on an orthopedic approach, so a little less likely to see your multiple sclerosis patient or your neurological patient. So that was one thing that I had to let them know, that I was going to educate them on how to treat these people, because they just, you learn so little in school about neurological diseases. And then once we're able to foster that buy-in, get them excited about doing something different outside of the box, it helps so much with retention. It helps also with, engaging that participant, developing a relationship with that participant, making that participant feel like they're part of the trial as well. And so that kind of has helped the success, I think, of this trial.
Your program is a PCORI-funded study with 2 treatment arms. Please tell us a little bit about the study design and the difference between these 2 arms.
So sure. So the first arm is a remote arm. It's called the Tele-CAM. This stands for Complementary Alternative Medicine. Our intervention delivered in both arms is the same. It's in yoga, Pilates, and then a dual tasking intervention. So the Tele arm is delivered through an app on the tablet that we provide to the participants. The participants in this arm also get what's called an interactive voice response call. And then the other arm is called a direct cam. So it is on-site. It's more your typical standard of care for physical and occupational therapists. It's 20 visits across 3 months. And then in both arms, they come back for a 3-month follow-up, a 6-month follow-up, and a 12-month follow-up.
Sir, what are some of the keys to effective telehealth rehab interventions versus an in-person type of approach?
So I think the way that we designed our Tele-CAM program, I was worried about individuality. When you see a patient on site, you're able to quickly adjust to their needs, realize, hey, this leg is weak, we're going to have to do something different here. So the way that I focused on developing the intervention for the Tele-CAM as well as the direct cam really was to add ways within each exercise to modify or challenge the exercise So that way, if they were having a difficult time, they could use the modification, or if they were finding the exercise easy, then they could use the challenge. We do have 6 different levels of our exercises.
Okay, great. What is the timing of this project, and has the pandemic affected the timing or delayed it, your research study in any way?
So yes, we had 25 individuals that were in the direct cam. So still in some process of coming to the clinic to do actual intervention, as well as we had 304 people who still needed to come back for follow-up visits on site. So we were able to receive a supplement from PCORI. This allowed us to continue those 25 people in their intervention by mailing them tablets, and the therapists have continued to do the intervention with the participant through a Zoom link. So they don't have access to the app the way the telecam participants do. However, they have access to the therapist who is doing the exercise with them. So we term this group, which will be analyzed differently, as our remote direct cam.
This is a really interesting discussion, and I really appreciate your joining me today.
Yeah, thank you for having me.